Is Kristen on? This is not the order on the screen, right? It's Umair, Scott, me, Lacey. Is that correct?
Correct.
Can you hear me?
Dr. Shah, if you could step just a little bit closer to your mic and we will begin.
Got it. I'm having against some video issues, and as soon as that gets addressed, I will jump on video, but I can start with audio. Can you hear me better?
Amir, it's a bit hard to hear you. You're a bit muffled.
Okay, hold on. Okay, how's that?
Excellent, thank you. And
Perfect.
thank you for all of our attendees for their patience. Well, we had a couple of technical difficulties there. Good morning and welcome to the Thursday, March 25th COVID-19 response media briefing. I'm Corey Portner, your facilitator for today's event, and I'd like to welcome our panel. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Lacey Fehrenbach, Deputy Secretary for the COVID-19 response, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, and Dr. Scott Lindquist, Acting State Health Officer. To begin today's briefing, we'll open with remarks from Secretary Umair Shah.
Thank you, Corey. Can you hear me okay still?
Loud and clear.
Great. Well, good morning, everybody. I really just want to apologize again, as Corey just mentioned, about the technical
challenges this morning. I'm trying to get my camera to come on, and that will, I'm sure, happen as soon as I finish my remarks. So let me just start by saying my name is Dr. Umair Shah, and I'm the Secretary of Health for the state of Washington. And I really just want to appreciate all of you and all the hard work our media partners, everybody in our communities have been doing over the last several months and throughout last year. And just want to say thank you for, again, coming back to this weekly ability to share information with you. Before I jump into COVID-19, though, I do want to start by acknowledging recent events related to violence in our country. And I'm referring to the violence with mass shooting events, both in Georgia, as well as what occurred recently in Colorado. We all know that gun violence is a public health issue. It is something that all of us are focused on in public health. And we know that mass shootings are absolutely what everybody pays attention to, yet firearm deaths and injuries occur daily in states across the country, including in Washington, and include suicide, homicide, assault, and unintentional shootings. And we know that firearms are also the third leading cause of injury-related death in Washington, behind just poisonings and falls. We had over 800 firearm deaths, 842 to be exact, in 2019. So we've had more annual deaths from firearms than motor vehicle traffic accidents, and yet we as a nation continue to see issues related to both firearms, gun violence, and now most recently, the continuing scourge of mass shootings. Department of Health supported interventions have included firearm safety education, collecting, analyzing, and publishing data for public and researchers and partners, and working with those partners on injury and violence prevention programs. I just want to underscore how important it is for all of us to work together. First and foremost, our thoughts and prayers go out to all those who were impacted by these horrific acts. At the same time, we recognize that not just calling out those acts is important, but we really need to take definable steps towards addressing violence as a public health issue, as well as the hate and bias and discrimination and other aspects of what are the root causes of what sometimes and many times and oftentimes becomes really a bad situation that gets markedly worse. And so we want to do everything we can to really work with all of you, work with our community members and our partners to address gun violence, address injuries, but also to address the mental, social, and behavioral health issues related to these horrific events. And Department of Health is committed to that. As the Secretary of Health, I'm committed to that. And as an Asian American physician, I also want to recognize that we have been hearing the concerns from our Asian American communities across the country and across the state. And we're absolutely committed to standing by and standing with our communities, not just Asian American, but everyone who is impacted by these horrific events. So with that said, let me move to vaccines and COVID-19. So there are some really positive news related to vaccine milestones. We are getting close to our 3 millionth dose being given in the state of Washington, which is just amazing if you think about where we were at the beginning of January or even the latter part of December, to have close to 3 million doses given in our state. And we're hopeful to be able to have that milestone passed later this week or through the weekend, early part of next week. We've had more than 1 million people that have been fully vaccinated. That's more than 14% of the total population of the state of Washington, and almost half of the people age 65 plus. We've had almost 25% of our total population, and more than 70% of those above the age of 65 who have gotten at least one dose. So they are partially protected from COVID-19 with COVID-19 vaccine. We continue to see around 45,000 doses given across the state on a daily basis. And I do want to underscore this point as well. If you remember, again, back in January when we set our goal, at that time we said 45,000, it's going to take us 2 months. It's a 60-day goal. And we were at that time 12 to 13,000 vaccines a day. So to be able to get to that goal and meet the goal, but also exceed it, which is what we've been seeing recently, we are very encouraged. And now we're looking at what will be the goal as we set moving forward. And so that is also something that has been incredibly gratifying for all of us. And I want to thank all of you, our partners, everybody in the communities for getting vaccinated. And the key message for all of us, to our partners, is don't hesitate, vaccinate. And to our community members, don't hesitate, vaccinate. I do want to clarify something. There has been some confusion in media reports about the May 1st eligibility. As you all know, President Biden and the administration announced a directive that everyone above the age of 16 will be eligible for vaccine by May 1. That means all Americans above the age of 16. We at the state will be following that president's directive, but we also acknowledge the fact that we have a lot of work to do between now and May 1. We have said this since the initial announcement and have been assessing the path to get there based on supply. And I do want to remind everybody of the three-legged stool that I spoke about over the last couple of sessions, that it's vaccine supply, it's vaccine logistics and administration, and it's also vaccine demand. And right now, supply continues to be the limiting factor, the main limiting factor, but we are hopeful that that will continue to increase. And we want to appreciate the efforts of the Biden administration, but we also recognize that more is going to need to be done from a supply standpoint so we can focus on administration and then certainly simultaneously putting our attention towards vaccine demand. And that is going to be increasingly an issue for all of us in public health across the country. Let me also turn now to some highlights for disease transmission. We have had 335,606 confirmed cases of COVID-19 in the state of Washington to date. And unfortunately, we've had 5,200 deaths. And I do want to, again, underscore that while these are numbers, these represent people and families and neighborhoods and communities that have been impacted by this horrific pandemic. Our daily case counts have flattened at an average of 654 per day as of March 11th, which is concerning. So remember, we've had three surges. We had the surge early in the spring, we had the surge in the summer, and then we had the third surge in the winter months. We're coming off of that surge. However, we're still having an average of 654 cases on a daily basis being confirmed. This is still relatively high, around the level we saw in mid-October. So while it may feel that we've come off the surge and we're actually making incredible progress, and we have been, that flattening or that plateauing is very concerning to all of us in public health and really underscores the reason that we have to continue to remind ourselves of the importance of all the preventive measures, especially wearing a mask, but also staying away from others and close distances, and also recognizing the importance of good hygiene and also getting tested. And certainly the last piece of that is also vaccinations, which I've already talked about. Hospital occupancy has been declining steadily from January to mid-March, but we have started to now see a slight uptick as well. So caution is still needed. The spread of variants across the state, flattening or upticks in hospital admissions, the fact that many people are not yet vaccinated means that we are very concerned. And I really want to, first and foremost, thank everybody for all the efforts that they have given and made and the sacrifices in order to be able to fight this pandemic in the state of Washington. But I also want to have a message to our younger populations who have both lower vaccination rates, can get still relatively sick, and have a serious outcome from COVID-19, and who are also showing up in our data as being people who are still getting sick from COVID-19. And this is of concern to all of us. Dr. Lindquist is on. He's going to provide more detail on the recent trends in the data. But I want to say that we're making great progress on vaccines. I also want to thank our efforts with the Vac Center and Dan Laster from last week, the announcement of the work to make getting a vaccine easier for Washingtonians, that the process and the experience of getting vaccines is better We obviously aren't where we need to be or want to be, but we've gotten better, and we continue to progress in a way that is going to serve all Washingtonians, no matter who they are or where they live. It's absolutely critical that we do as much as we can, as quickly as we can, while we also have an eye towards doing it equitably. And with that, let me turn it back over to you, Corey. I really appreciate everyone's attention this morning. And again, apologies for the technical difficulties.
Thank you, Secretary Shaw. Next, we'll go to Acting State Health Officer Scott Lindquist.
Hi, good morning, everyone. So I've described myself as cautiously optimistic about these trends the last couple of weeks as we're starting to go down the backside of this third wave. Today, I'm going to say I'm much more cautious than I am optimistic, and for very good reasoning. Our downward trends have really slowed and flattened in many places. When we look at the statewide trends, it's a lot of variation from county to county. We have 23 of those counties have less than 100 per 100,000 cases, but 13 have anywhere between 100 to 200. And we have 2 counties with case rates of 200 to 300 per 100,000, and a county of concern with greater than 400 per 100,000. All these from our modeling and our measurements are what has really given me the caution right now. And we've seen some variation in age groups. We would expect to see this decline in the case rate in those 60 and older because of the effect of vaccination. So that's actually promising. But we are starting to see a flattening of that decrease in cases for those that are hospitalized older than 80 or 40 to 49. So again, one of the measures we use is to look at the R0, or what is thought of as the number of people infected from a single case. And we do it a little more sophisticated. We take out those who have already been infected or who are vaccinated, and it's what we call the RE, or effective R0. And that should be less than 1. If you have infecting less than 1 person, this pandemic starts to slow down. What we are seeing now is it is close to 1, but seems to be a bit elevated above 1, which is what we are hearing anecdotally from several counties, that they're starting to see uptick in cases. So again, this is very concerning for the question of a 4th wave. So the bottom line is that we are seeing some variability across the state and age groups, but this is time to proceed with caution. We need to really emphasize vaccinating as many people as possible so we can affect that are effective or are not. Use masks, use social distancing, and actively limiting spread by making good choices in the community. That is as simple as travel or congregating in settings. So this is the time to join me and be cautious about our epidemiology. And I turn it back to you, Corey.
Thank you, Dr. Lindquist. Next, we'll go to Assistant Secretary Michelle Roberts.
Good morning, everybody. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the department. Dr. Shaw shared many of the milestones with our vaccine numbers. I'm particularly grateful that more than 1 million people in Washington are fully vaccinated now. Our 4 state-led mass vaccination sites are also continuing to do incredible work. Since opening January 26th, they've given out more than 145,000 doses of COVID-19 vaccine. I'm proud of the hard work of our team, our healthcare providers, and the public. We are all in it together to protect our community and get everybody vaccinated as quickly as possible. Next week, we're expanding vaccine eligibility, opening it up to people who qualify under phase 1B, tiers 3 and 4. This includes people with 2 or more underlying conditions, those age 60 and older, as well as people living in certain congregate settings, and some additional high-risk critical workers. We estimate that these tiers will add about 2 million more people to the roughly 3 million people already eligible for vaccine in our state. If you're eligible now and you haven't gotten your vaccine, please go ahead and schedule your appointment. When eligibility expands, appointments will fill up much faster due to the surge in demand. If you need help finding an appointment, the state's new and improved vaccine locator website is a great resource. In just a week, our new site has already helped more than 400,000 people find vaccine near them. For a more detailed list of who's eligible, visit DOH's website and search for our COVID-19 vaccine allocation guidance. Now let's talk about vaccine allocation. Our 3-week forecast from the federal government shows we'll be getting more than 42,800 doses of J&J vaccine next week, which is great news. Because of this, next week we expect to receive more than 400,000 doses of vaccine, which is the most we've ever received in our state allocation in 1 week. But after next week, the forecast again shows no doses of the Johnson & Johnson vaccine, bringing our weekly allocations back down to around 350 doses per week. To put that in perspective, right now we have more than 1,400 enrolled providers across the state. And this week they requested almost 500,000 doses of COVID-19 vaccine. Another piece of good news is that soon more vaccine will be coming to Washington through a different federal allocation. FEMA has chosen Yakima to take part in an 8-week federal mass vaccination program. The site is scheduled to open March 31st and will administer close to 1,200 doses a day. Vaccine for this FEMA site will come directly from the federal government and not from the state's weekly allocation. Those additional doses will help us vaccinate more Washingtonians, including people in rural and agricultural communities that have been particularly hard hit during the pandemic. Today, I also want to spread the word about another tool we have that I'm here in Washington that allows people to access their immunization records. It's called My IR, or My Immunization Record. And it's a free online system where you can see your past vaccinations and get reminders for you and your family and print official immunization records. This information is helpful to have to ensure you get the correct second dose if you're getting a 2-dose vaccine, like Pfizer or Moderna. It also helps make sure you're getting the second dose within the right time frame. 2 doses of the Pfizer vaccine should be given 21 days apart, and 2 doses of the Moderna vaccine should be given 28 days apart. Vaccine, as we know, is the best tool we have to end this pandemic. What's great is that most people in Washington plan to get the COVID-19 vaccine to protect themselves, their family, and their community. We know some people have questions about the vaccine, and I believe knowledge is power. When friends and family ask me what I will do, I recommend strongly that they get the vaccine when it is their turn. I want people to feel confident that the vaccine is a safe and effective way to protect themselves from COVID-19, and especially from severe outcomes from COVID disease. That's why I encourage anyone with questions to talk with our healthcare providers and other trusted community voices like community and faith leaders. The Department of Health, along with other public health partners, have answers to frequently asked questions on our websites and lots of educational videos and content if you have questions. It's important we're transparent, provide consistent information, and we can all do our part to build community immunity through vaccination. You can learn more about the vaccines at covidvaccinewa.org. So that's covidvaccinewa.org. We have information on safety and effectiveness on that site, how the vaccine works, and other frequently asked questions. Every single person who gets vaccinated and completes the series helps protect all of us and brings us one step closer to ending this pandemic, reopening our economy fully, and being reunited with our family and friends. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Deputy Secretary Lacey Fehrenbach.
Good morning, everyone. Thank you for joining us today. A couple things here. Last week, Governor Inslee rescinded his travel advisory that was issued in November of 2020, and he advised Washingtonians to comply with CDC's travel guidance, and that would also apply to anyone visiting the state of Washington. This CDC guidance is more robust and specific than our state advisory was, and it's regularly updated to reflect emerging science and safety practices. I want to be clear with everyone that this change does not mean that traveling is now safe. Traveling increases your chances of getting and spreading COVID-19, as you heard Dr. Lindquist share earlier. The safest option for your family, your loved ones, and the community you live in, and any community you're considering traveling to, is really to stay home right now, given where we are in the pandemic. We know that families are very eager to get out of the house and spend some quality time out with loved ones. We also know that college students may want to return to see their parents or go on a road trip with their friends. And we're really asking people to stay close to home and make that safer choice for their families, schools, and communities. The things that we can do are support our local businesses, visit our local parks, and we have some pretty amazing ones here in Washington State, local, and national parks and forests. You could also support your local museums and art scenes. If you must travel, we really encourage you to take steps to protect yourself and others. Before you embark, you need to know all of the policies of your destination. Everyone who's traveling with you should get tested 1 to 3 days before you leave. And certainly if anyone tests positive, you need to cancel your trip. Everyone should wear masks, and we recommend that even if your destination does not have a masking order, like the state of Washington does. We encourage you to avoid large gatherings or events, and also avoid crowded or confined spaces. If you need to dine out, instead of eating inside the restaurant, try to sit outside or get takeout and take it to a park. When you return home from your trip, you'll need to get tested again 3 to 5 days after you arrive, and you need to stay home for 7 days. If you choose not to get a test, you need to stay home for at least 10 days. We have made tremendous progress. However, as you heard, the majority of Washingtonians have not yet been vaccinated, and we need to keep taking precautions to protect ourselves and our communities. You heard from Dr. Lindquist that our disease rates are still relatively high, and we are seeing some upticks in certain parts of the state. We really want to avoid that fourth wave and encourage families to make a good choice here. The second thing I wanted to talk about is graduation. We recently released guidance for public and private colleges, universities, and K-12 schools to use when planning celebrations for the class of 2021. At this time, virtual or drive-through ceremonies are still the safest option to celebrate, but in-person events could be possible. They are at the discretion of the school or the university or college, as long as they comply with Governor Inslee's Healthy Washington Roadmap to Recovery plan. It's important to note that while all counties right now are currently in phase 3 and have the ability to host events, the event is likely to happen later, and counties could be in a different phase at that time. So your school would have to conform with whatever the guidance is for phase 1, 2, or 3 as appropriate for your county's disease level. For any ceremonies that do take place, we have some thoughts about precautions, and those are in the guidance. Everyone in attendance needs to wear masks and avoid close contact with people from outside their household. We need the venues to have a plan for staggering entry and exit, both for the honorees and for the guests, and pay attention to common places where bottlenecks are likely to occur as people move throughout the space. We recommend that people not shake hands with the graduates, and that everyone who attends sanitizes or washes their hands as they come in or exit the ceremony. We also recommend cleaning those high contact surfaces, ensuring good air quality and ventilation at the event. And certainly anyone, whether an honoree or a guest, should stay home if they are sick, showing any signs of COVID-19, or have been recently exposed to someone with COVID-19. Lastly, we think it's important to avoid social gatherings before, during, and after the event. And we know that that means, that's a change for people. We often see friends and family, people we might not have seen for a long time, especially now, but really encourage people to avoid that congregating, formal or informal, adjacent to the ceremony. More information and the guidance is available on our website, and to all of the students in Washington graduating or moving up this year and their families, We are so proud of you for reaching this milestone. We congratulate you and we look forward to your future successes in our state. And with that, I will pass it back to you, Corey.
Thank you, Deputy Secretary Fairmuff. This brings us to the Q&A segment of today's briefing. We do have a number of media with questions today. If we're not able to get to your question in time, please reach out to us at doh-pio@doh.law.gov. We'll be able to get your response that way by email. All right, to begin, we will open with a question from Jessamine at Q13.
Good morning, everybody. Thank you so much for your time. Really appreciate it every week. In fact, Governor Inslee has a press conference at 3:15 today, and while he hasn't said it yet, the assumption is that he's going to reduce the spatial guidelines for classrooms from 6 feet to 3 feet. Do you have any concerns about that, allowing more children back into the classroom, or are you encouraged by that because it does that?
Jessamine, thanks. I finally have my video going, so thank you for that question. And we have continued to work hand in hand with the governor's office throughout this pandemic, but particularly with our common goal and the concern that we have about kids who are not in school in person, but attending school virtually. And we've made the case previously that we believe that kids can go back to school in person and that it is safe for them to do so. And in fact, as you know, that there's plenty of data throughout the state of Washington of hundreds of thousands of kids, 300,000 plus to be exact, that have gone back in person safely. So from that standpoint, we continue to work with the governor's office and are appreciative of not only his leadership and vision on this, but his real concern about children and concern about students, but also concern about the entire ecosystem, including educators, including all the support staff, including parents and everybody that's involved in the school system. So as far as his announcement or planned announcement today, I'm going to let him announce before saying anything more. But I will say that our team has continued to look at the science and the evidence behind the CDC's previous guidance related to 6 feet and now their revised guidance related to 3 feet. And we do believe that there is merit in looking at ways to get kids back in school, but to do so safely. So that's really my perspective. And Lacey, I don't know if you wanted to add anything to that, but really just to say that again, when the governor announces his comments or makes his comments later on today, then we'll obviously have more information about this or other issues. Lacey?
I think you covered that well. From the beginning last summer, when we started planning for return to in-person learning, we have focused on protecting the health and safety of the students in the school buildings, the staff in the school buildings, the families they go home to, the communities that they live in, and really letting the science drive that. And I think that we are still very much operating in that phase, and we'll continue to do so as we move forward and this afternoon and beyond.
Yeah, I do want to say we do recognize how difficult this issue is, and we want to provide as much public health information and guidance as we can. And we've been working with OSPI as well as other education systems. We've heard from plenty. We've gotten plenty of comments and emails and correspondence. And we know this is an important issue. So we're not dismissing this issue whatsoever. We do believe that the guidance from the CDC reflects evolution of understanding of what we can do to not just protect our kids and everybody else within the school, but also how do we do that in a way that's also going to promote their education, their childhood development. And we are concerned about the other aspects of impact from schools not being open for in-person learning. And so we're supportive of all that, but again, we're going to wait for the governor to make the announcement or set of announcements that he will, as he always does on Thursday. So we're looking forward to it.
Our next question comes from Ariel with the spokesman review.
Great, thank you. I think my question is for Dr. Lindquist. Could you give us an update on breakthrough cases and how the state and local health jurisdictions will be reporting those? And then if you could also define a breakthrough case, I think there's probably some confusion on what that means for folks.
Yeah, I can give you an overview of this. The definition, so we're working very closely with the CDC on this to identify what is a breakthrough case. Because as you all know, these vaccines are not 100%. So we are expecting that there will be some people that get COVID-19 despite vaccination. So we have someone on the advisory committee with the CDC around breakthroughs. And the definition we are following is the same as the CDC. Someone who has received a full series of the vaccine. So currently it means 2 doses of the Pfizer or Moderna or a single dose of J&J. And then 2 weeks have followed so that you've had enough time to develop immunity, and that you then test positive for COVID-19. And so this is part of our big issue around amping up our genotyping capabilities. So what we are actually doing too is trying to get the virus and genotype it. We are working with every local health jurisdiction to identify any epidemiology that would point to things like, is it more common with a certain vaccine? Is it more common with a certain lot? Was there storage issues, things like that? Anything that would show us trends. And again, we're expecting to see numbers, and we talked with the CDC as recently as last week. And so as we get these cases, we'll roll out what we know about them. It's way too early for us to really speculate on what we're finding at this point.
Scott, would you want to clarify what type of test too? Because it is important what type of test you're testing positive on with a breakthrough case.
Yeah, what Michelle's alluding to, the only test that allows us to be able to identify the virus and then genotype is a PCR test. That is, some people will only get a rapid antigen, and we will call them probable breakthrough cases, but to really confirm this, it takes a PCR and us to really look at the DNA and the genetic material. I don't know, Umair, if there's anything you'd like to add to this, or Lacey?
Well, I just thank you, Scott. I think you've said it, and let me just underscore that. Yes, we've had instances of breakthrough cases in the state, as we've seen across the country. We are continuing, as Scott mentioned, to work with our federal partners and local partners to both gather and vet that information so we can quantify it and make sure that, as Dr. Lindquist nicely stated, that we can make sure that it qualifies, that it's appropriate for being classified as a breakthrough case. And we're hoping to be able to release that information soon. But vetting that information, making sure that it's comprehensive and making sure that it's accurate is what we're in the midst of doing right now. But I do want to underscore the absolute critical importance that breakthrough infections happen, but they are rare. And we do not want people to feel that this is a reason for them not to get vaccinated. Vaccines absolutely work. They're effective. They're safe. We now have 3 vaccines, and we may even have a 4th, but 3 vaccines that are safe and effective. And we just want to make sure that people get vaccinated and do not think about some of these additional concerns that are out there in a way that drives them not to get vaccinated, because these are very effective and very safe vaccines.
Our next question comes from Joey, the Everett Herald.
Hi, two-part question. First, any update on vaccine wastage and what that's looking like given the slowdown in demand? Also, it seems like on the vaccine locator, it's been pretty easy for folks to find doses in the last week or so. Any reason why the state isn't advancing to that full tier 2, or that by advancing from the 31st to now, given how easy it is, opening it up so there's not a lag in demand before all those extra folks are eligible.
Joey, thanks for that question. Michelle, I'm gonna take that second one first, and then I'll let you add to that, and then also add to the wastage question, if that's okay. So from the standpoint of Vaccine Locator, that's great to hear. I mean, we are doing everything we can to make sure that we are as effective as we can be, and I call that excellence, the effectiveness, the percentages, the numbers. Equity, the second part of this, would make sure that no matter who you are, where you are, if you're eligible, that we can work towards getting you vaccinated. And the third is experience, that the experience is a positive experience. And so those are the 3 E's, but they're not easy by any stretch of the imagination. Excellence, equity, and experience. Joey, what I think is really critical is that we are continuing to see demand for the vaccine that outstrips the supply of vaccine. And so while we do think that there continues to be room to monitor the numbers, and if we get to a point where we are feeling that we can advance a group or a set of groups, then that's something absolutely that's within the purview of decision making. But right now, we also believe that the demand continues to be there in the current group. And so, as you remember, we had already moved up the tier from March 22nd to March 15th. And so now we're having good flow of demand for the most part everywhere. There are a couple of pockets here or there where you may hear that people are saying the demand is starting to slow or what have you. But we do believe that right now, March 31st, that we are going to continue to comfortably get there. And I do want to say that from March 31st to then May 1st, we've got a whole month, 4 weeks of information and monitoring that we need to do so we can get to that president's goal, and that the state has now adopted as well, which is to make sure that all Washingtonians above the age of 16 are eligible for vaccine by May 1. But we want to make sure we get as many different groups in before we open up to the entirety of the population. So right now, no plans is the bottom line to go faster. But if the data changes, then obviously we would look at that as well. Michelle?
And before I get to the wastage data, just want to echo Dr. Shah and just really make a point that the last week, we've been vaccinating some of our most critical worker groups, and they do take a little bit more time to be vaccinated. And we want to make sure the ones that are included right now are groups that have had higher rates of disease during the entire pandemic. So it's really important to give them an opportunity. And just how they are able to be vaccinated looks different than our other groups. So we're continuing to adjust our vaccine strategies. So now that we're targeting critical workers versus 65-year-olds, what time of the day, when they may be able to go, balancing that with their work schedule is all a piece of that. So we're working on, we have our mass vaccination strategies, but also continuing to work with local health departments and others around mobile vaccinations and other strategies and timing of the day of when appointments are being offered to just really make it as easy as possible for these important critical workers to be vaccinated and get them protected to try to help any further outbreaks of the settings they're working in. As far as wastage, I've got great data to share. Less than 4,000 doses of vaccine have been wasted in our state. I mean, that's incredible. We've had more than 3 million doses distributed to the state. So wastage is really not an issue. We continue to work with healthcare providers to make sure they have plans for what to do with any doses at the end of the day that have been already taken out of the refrigerator to make sure everything is, every dose is used. Obviously, the incredible work of our healthcare providers is really showing in those wastage numbers. It is not an issue that is happening.
Our next question comes from Anna with KUOW.
Hi there, thanks for taking my question. Speaking of those pockets of slow demand that Secretary Shah mentioned, this week I've seen hundreds, if not thousands, of open appointments at mass vaccination sites in Eastern Washington. And a colleague of mine went and said it was quite empty, actually. And yet, over here in King County, appointments are still hard to find. People are even hanging around outside the county's mass vaccination sites. So I know that the state prioritizes doses to mass vaccination sites. Given what seems like a mismatch in supply and demand, do you think perhaps it's time to rethink that allocation strategy so such a large amount isn't automatically going to the state's mass vaccination sites?
Yeah, thank you, Anna, for that. And I'll let Lacey clarify the mass vaccination. Our 4 sites compared to the efforts to have mass vaccination efforts or continuous support efforts that are happening on the ground with other local health partners who are operating a mass vaccination effort. So, for example, what I mean by that is yesterday, as you know, I visited Lumen Field, and a great shout out to all the partners on the ground, City of Seattle and King County, and certainly Swedish and everybody else that was involved in that operation. And one of the biggest things that they were sharing with me is that vaccine supply remains an issue compared to the demand. And so a mass vaccination effort that obviously Department of Health at the state we support, and we've continued to work with them and work with our local partners, but it's not one of the 4 direct mass vaccination sites that we are operating ourselves. So Lacey and maybe Michelle, but Lacey will be able to provide some additional data related to our mass vaccination efforts. But as far as the strategy goes, we are constantly looking at whatever we need to do or have to do in order to pivot from where we've been. And if that means that we need to relook at strategies of how to balance supply and demand, or balance geographic considerations, or balance where we have a slowdown in one area or a quicken pace in another area, everything is on the table. We're continuing to assess. And I think that's been one of the hard things for many of our community members to keep in mind, is that we have felt like we've had a plan and we've been executing on that plan, and then something has shifted, something has changed. And so when we then pivot to that new change, then people say, well, why did you pivot from what you previously had? Well, things on the ground, facts on the ground have changed. So we have always allowed ourselves the ability to have flexibility to move in a different approach or an enhanced approach. Right now, we feel that we're in a good place, but again, we continue to monitor the information around mass vaccination everywhere, our 4 sites, plus what's happening in other communities across the state. And I do want to mention that we are also mindful that we are now going to have the FEMA supported site in Yakima that's going to be starting March 31st. It's a type 3 site, which means that it can vaccinate 1,000 to 1,200 a day when it finally ramps up. And we're working with Yakima Health District, as well as partners on the ground, as well as our federal partners, to be able to get mass vaccination efforts up in that site as well. So constantly pivoting, constantly evolving, constantly looking at what's going to continue to be able to meet or match the demand. Right now, not pivoting with the question that you asked, because I'm not sure that it actually, your comment initially about the doses that, or the people that are not going, is truly what's happening at our 4 mass vaccination sites. But Lacey, Michelle.
Sure. So I can quickly jump in here. Our mass vac sites are doing 600 to 1,000 vaccines a day. There are 4 of them. That adds up to about 20,000 to 30,000 doses a week that are being allocated in a given week to those 4 sites. And, as Dr. Shah mentioned, we are always looking at our allocation and balancing the distribution of vaccine across the state, as well as where there are needs to catch up on pro rata, and potentially different types of strategies needed to reach the people who are eligible at that moment in time. And so we are looking at those data points, and always looking at ways to better get people vaccinated as quickly as possible within phase and move through those phases as quickly as possible.
Just want to add, a couple other pieces of information. So the 20 to 30,000 doses, let's remember we're over 350,000 doses of vaccine a week. So that's really only 5 to 10% of our doses, depending on the adjustments Lacey is talking about making. A couple other pieces is we are adjusting. Like I said earlier, right now, mass vax may not be the best site for some of the critical worker groups we're doing. And so in our sites, especially in Eastern Washington, we've made some adjustments. We've decreased the amount of first doses that are in those clinics this week. And we partnered with local health departments to think about other strategies and shift some of those doses to community vaccinators or local health departments to help reach especially our agricultural community on the east side of the state. So those adjustments are being made in real time. Another thing we're seeing with some of the critical worker group is that they're not necessarily pre-registering for appointments at all the time, which is something we would discourage, but it is a fact of what is happening in some of our mass vac sites in Eastern Washington, where we do have groups of critical workers showing up kind of in a more walk-up fashion. And so they are taking some of those available appointments up during the day. But we will continue to watch this very closely. And I think we'll see a change on mass vaccination will be another more important strategy across the state as we get into some more broad groups of the public next week that are eligible again. So just something we're going to have to keep watching and make adjustments in real time to make sure no dose goes to waste. We do hold our mass vac sites accountable to the 95% rule as well, which is another piece we use to adjust to how many doses may be there the following week.
Our next question comes from Steve with Como.
Hi there. Thanks for taking my question. I have two questions for you this morning. One kind of echoes the question that Joey asked a few minutes ago. What do you say to people who are seeing a number of other states across the country expand vaccine eligibility to everyone above the age of 16 now, as opposed to waiting until May 1st, and wondering why isn't Washington doing that? Why not move faster than May 1st? And the other question I had was, last week DOH had stated that sometime in April, we're expecting to see weekly vaccine allocations from the feds jump substantially. I think the number was near 600,000. Have you guys been given any more information about when we might actually see that big jump in allocations from the feds?
Steve, let me take that first question, and then I'll let Michelle talk about the allocation piece. Let me start with clarifying what I was saying. We know that May 1st, that all Washingtonians above the age of 16 will be eligible. So we know that. We've got 5 weeks before we get to May 1. We still have demand with even the groups that are currently eligible. In fact, we have just announced another set of groups that are going to be eligible in 6 days. The demand in the current tranche that we're in is still there. So we've got 5 weeks before we open up to adults or 16 and above, if you will, on May 1. And then we also have demand on where we are. And we also have another group that's opening, that's coming forth in just a week or so. So all that is a long way of saying that we believe that right now we're making progress in vaccinating, but also doing so with an eye towards demand. And the reason that we had put certain populations first was because of our concern about their risk, and whether it was risk because of age or comorbidity, or because of risk because of occupation. There is something that was about those individuals and those groups being at risk. So we don't want to open up to everyone until we've been able to actually continue down that road. Now, that said, we are continually looking at this, and if it appears to us that there comes a point where the vaccine demand has slowed down, or we just aren't getting as many people, or we made some estimates based on people that are going to be getting vaccinated, but those folks are deferring right now, or they're waiting, and we've gotten through the populations that are eligible faster, then absolutely there are things that we're going to continue to look at. And governor's office has been very clear. Governor's been very clear. Every time, and on a daily basis, every time we see some change, we see some reason to relook at something, we are absolutely going to do that. But right now, we feel that there is enough demand in the current eligible populations that we have not had to do that. That said, we're also working with our state partners across the country. I'm on calls with the secretaries of health, the commissioners of health across the country, and we're sharing what's happening. There are some states that have moved forward. My previous home state of Texas is one of those states that's moved forward. There are other states that are moving forward. There are other states that are not moving forward at this time. There are other states that are doing something in between. And so we're just going to continue to do what's best for Washington. And as long as we know that people are getting vaccinated in the appropriate groups, we're going to continue to go that route, knowing that in 5 weeks, at that point, everybody above the age of 16 will then be eligible. And so from our standpoint, this is the right strategy. But again, continue to monitor this if we have to pivot. And with that, Michelle, you want to add to that?
Yeah, I just want to add that, I mean, our strategy is really driven by our state's commitment to equity. And Dr. Shaw said, we know there are many groups of people who have higher risk from this disease. And we really want to make sure they have a turn to be in line before we open up to everybody, just to manage that supply and demand. I mean, we've seen how hard it is for people to earlier in our vaccine eligibility if the group is too big. But like we said, we are continuing assessing supply and demand to really make a decision about when is the right time to move to the next group and what may our pathway be between now and May 1st. The great news is May 1st is not that long away, and we'll all have a chance to make sure we're vaccinated and our friends and family. And we know we're all tired from the pandemic, and I think that's a lot of the interest about making sure we can get as many people vaccinated, and people who are, 70% of Washingtonians are saying they're going to be vaccinated. So we still have a long ways to go and a lot of people to get protected. The other thing I'll say is one of the pieces that's driving your first question was really about vaccine supply, and we don't have a clear pathway from the federal government yet. We do hear that they continue to say that in April, we'll see much bigger amounts of vaccine coming into our state, but our weekly allocations are not really reflecting that. So we did get good news this week, like I said, but it was on Tuesday morning for our allocation for next week that we are going over 400,000 doses for the first time. But then, as I said, our next 2 weeks of allocations are dropping down again to around 360,000 doses. So we need a lot more information from the federal government to really understand the pathway and to make sure we're matching eligible groups to supply, and really feel like that's our commitment to Washingtonians, to not pull in more people than we have vaccine to, and not opening up broadly till we understand the pathway to May 1st.
Our final question comes from Eleni with KXLY.
Hi, can you hear me? Sorry, I actually don't have a question anymore since everyone had already asked it. But thank you.
That's excellent. I will throw it back into the pool. All right. Our next question comes from Ashley with South Seattle Emerald.
Hi, thank you so much. So I think in previous press conferences, we had talked about how the Johnson & Johnson single shot vaccines would be allocated to populations that are difficult to maybe sign up for the next shot, such as people who are on fishing boats, farm workers, people experiencing homelessness. Has that moved forward? Is that something that we're doing?
So next week is really the first time we're getting a more substantial amount of Johnson & Johnson vaccine coming into our state again since kind of the first initial week that it was available. So next week, over 42,000 doses are available. We have divided that allocation up evenly between our counties, and the counties are, they're kind of pro rata or their proportional share. Counties are using it for many different strategies, including those hard to reach populations. So I know some are planning to use it for clinics to reach homeless people experiencing homelessness when we open up that group next week. Some of the other critical worker groups you've mentioned. So they're really putting it into clinics and providers that are helping meet those different vaccination strategies. And so a lot of those decisions are being made at the local level about where best to put that vaccine to help further making sure the eligible populations are vaccinated.
Thank you.
Corey, really quickly, how many more questions do we have in the queue?
4.
Why don't we try to take all 4 of those questions, if that's okay. We'll try to go a little bit longer, but also a little bit shorter on our answers. But why don't we just try to get to all of the media partners?
Well, I'll appreciate that. All right, our next question comes from Whitney with CREM.
Good morning. Thank you so much. I really appreciate you taking that extra time, Dr. Shaw. My question is actually a two-part question, and I'm just wondering if you would consider a more regional approach for vaccine eligibility. Again, talking about those unused appointment times, especially here in Eastern and Central Washington. We know several of those sites have empty appointments every single day. Has there been, or would there be, any consideration to maybe open up eligibility to more people so that they can get vaccinated sooner?
Yeah, thanks, Whitney. And, again, I'm not sure that the regional approach would necessarily be the right way to go. It's really working towards lack of confusion across the state so that there isn't confusion that one set of communities are going one direction, another set of communities going another direction. So right now our goal is to move forward as a state, and we feel that we've been successful at doing that. Now that said, we are at times working with partners to see what we can do to advance issues within their communities, if we need to transfer or do something else, and we've been absolutely committed to that. But right now, a regional approach, I'm not sure is the right answer. I will say, though, what we do want to do is make sure that we don't get in a situation that we open up prematurely and then we have more people that are eligible, but then guess what happens? They're all fighting to get vaccine, and then ultimately those who we are concerned about being most at risk aren't able to get vaccine. And that's the reason why we've been methodical. But remember, on May 1, all Washingtonians above the age of 16 would be eligible for vaccine. So really, it's what do we do over the next 5 weeks? Your second question. I think you had two. Okay. Corey,
okay,
I guess.
yes, sorry, I was
sorry.
muted. I apologize.
Okay.
Yes, the second part of my question is just what do you say to the people who are opting out of getting these vaccines? Many people are just choosing and saying that they just aren't going to get it and they have no plans to get the vaccine. What do you say to those people? And are you concerned about it possibly causing a fourth surge or possibly even slowing down our reopening efforts here in Washington?
Yeah, I'm absolutely concerned about that. And I'd like to tee that up also to Dr. Lindquist. Scott, if you could be ready, because I'm going to give my thought, and then I'd like for you to, because you do such a nice job of being able to share that that concern as well. Look, we have worked so hard as a nation to get to this point where we have a way out of this pandemic, which is the promise of vaccines. But vaccines are only as effective as being in the arms of people. And if we are not able to get people vaccinated, or people are opting out to get vaccinated, that is going to be a terrible tragedy. That we want people to get vaccinated. We have to do everything we can to provide information, to dispel myths, to dispel misinformation, mistrust, distrust, all of those things. We have to make sure that everybody, regardless of who they are, where they live, that they are able, when they're eligible, to be able to get access to vaccines. And yet when we give access to vaccines and people are just not availing of the vaccines, I am terribly concerned about that. And we all in public health are very concerned about that as well. So absolutely, this is something. So I would say to people, don't hesitate. Vaccinate. Please get vaccinated. When you are eligible, please get vaccinated. All 3 vaccines that are currently available are safe. They are effective. This is the way that we can actually get out of this pandemic. And I don't just mean get out of this pandemic as a nation or as a state, but I'm talking about being able to go back to partaking in activities safely. That all of us want to get to a point where we don't have to always be thinking about just COVID. We want to be able to go back to activities in our lives as we used to know them. It's going to be a long time before we can get there, but the faster we can get people vaccinated, the faster we can return to those times. Scott?
Yeah, I guess I would put it this way to folks that are thinking about vaccination. It's not just about you, okay? So myself as a physician, I get vaccinated to protect my patients. I get vaccinated to protect my family and loved ones and friends. And so we need to get to this point where we're starting to think about what's best for the community. We know a certain percent of the community either has to have had disease or get vaccinated to stop this fourth wave or this pandemic. On a more practical note, I will tell you this. My personal interest is to travel to Iceland. I just learned that tomorrow Iceland is going to let me come. I'm not going yet, but it's going to let me come as an American to Iceland if I've been vaccinated. So that's a very practical side. I think we're going to see the whole travel industry move around differences if you've been vaccinated. Certainly people are talking about vaccine cards that allow you to travel around the world. So just to be clear, though, if you go to Iceland tomorrow, you still need to wear a mask. You still need to test before you go or before you come back to the United States. So those are two very practical trends. One is you're doing it for the community, and the other is it's going to allow you to have some variations in travel availability too. So with that, sorry, I know we're trying to have short answers here, but these are really complex questions. Thanks for asking it, though.
Thanks, Scott. Corey.
Our next question comes from Tom with the Public Radio Olympic Bureau.
Thanks for taking my question and hanging out a little bit longer. A very quick question for Dr. Lindquist, and then another one for Deputy Secretary Fehrenbach. Dr. Lindquist, can you give just a little bit of analysis on the epi curve for deaths from COVID, which was, at least when I looked last week, looked like it was plunging to zero or on that way. But has that also flattened out, like just the case count? And then for Lacey, have you had any conversations with small ship cruise lines, which are announcing plans to restart regional cruises on the Columbia River and in Puget Sound in about a month? And I'm wondering if there's guidance already for them or if that's still ongoing.
Yeah, Tom, thanks for that question. It's a great question. And the simple fact of the matter is it's an epidemiologic trend that deaths tend to follow several weeks behind the actual trends in infections in the community. As you can imagine, certifying a death certificate or getting clear what the cause of death sometimes takes up to a couple weeks, and even a month is not unreasonable. So I think our death trends, while I'm really happy that they are going down, they're starting to stall a little bit. And I think as we catch up to any fourth wave or increase in cases, we'll see those either stall and flatten or even go up a little bit. So just an epidemiologic trend that we see a little lag in the death data.
Thanks, Tom. We are still in conversations with the small cruise, riverboat cruise and other cruise lines. So aware that they are wanting to get up and operating, and we're in conversations with them and a number of other sectors as we continue on this pathway to recovery. And I'll see if we can get some additional details, and we'll have our PIOs follow up with you afterwards.
And Tom, just to clarify, that's the reason that Dr. Lindquist is not allowed to go to Iceland right now. Corey, next question.
We have 3 left in the queue. Our next question comes from Sandy with the Seattle Times.
Hi there. Thanks so much for taking these additional questions. Mine are probably for Dr. Lindquist. Does the B11 variant, B117 variant seem to be on pace to become dominant in Washington as was predicted? And a second part of that, I've seen some new modeling that underscores the importance of super spreading events and allowing variants to get a toehold. Are you seeing any evidence of super spreader events or genetic links between the variant cases?
Yeah, Sandy, great questions. We are seeing the spread of B117. It has not become the predominant strain yet. There's a variant report that will be posted on the website today. So I'd really encourage you to look at that, both our numbers and the variability of our variants. We are seeing Quite a bit of our variants are actually the California variants, and that makes sense. I mean, we're on the West Coast, but that is unfolding. I wasn't really expecting that. CDC also increased the number of variants they would like us to look at, and those are variants of interest, which include these California variants. So that's pretty insightful to us, what a percentage of the California variants are. One of our research labs that does some of our variant analysis says that about 30% of all the variants that they are doing analysis on are the California variants. So those are the main takeaway messages for us. The other bottom line statement is all the variants of concern and the variants of interest are being seen here in Washington State. And again, the whole goal for us is to increase the percent of all positive tests that are done to be genotyped. And we are leading the states in this, in the percentage of positives that are done. That'll give us a much better representative sampling of what is the predominant variant. So stay tuned on that. Look at the variant report that's posted today, and it'd be very interesting to see how that unfolds next week.
Our next question comes from Eliana, KEPR.
Can you hear me now?
Loud and clear.
All right. So obviously, we also have hundreds of unfilled appointments at our local mass vaccination site. So kind of echoing a lot of the questions that we've had, but are we at risk of losing any of those shots? And also, could we be more specific on how we make sure that, you know, doses don't go to waste, especially if they have been taken out of the cold temperature?
Michelle, why don't we turn to you for both of those?
Yeah, so how doses don't go to waste is their providers have, we've encouraged providers to have wait lists and have kind of standby lists. We encourage them to work with community-based organizations, other healthcare providers and others to make sure the people on that list are ideally in phase. But we've also been very clear with our provider community that if you have doses at the end of the day, that cannot be used, to please, start with a list, a group of your wait list of who's in phase, or then reach out more broadly to make sure those doses are used. There is kind of, vials can be taken from the refrigerator or from the deep freeze and can be in the refrigerator for a number of days before they go to waste. So providers are really good at managing their inventory, to taking out how much do they move from like a deep freezer to, or, the ultra cold freezer to a regular freezer. And there's different amount of time where they can be in there. And then it's really when they take out the vials to be used immediately that they can't go back, or there's a certain amount of time. So they're really good at managing that inventory. We are really not at risk about losing future vaccines. I mean, when you see the data reported again tomorrow, it looks like we had a couple slower days, but we're the doses per day are increasing again. So I think it is, just part of what we're seeing of reaching some of these harder to reach populations that are really important to be vaccinated. They have had high rates of disease and have been more at risk. And like I said, we're making adjustments about where the doses are, what are strategies to do that. And then next week, we'll be opening up to a bigger group of people to ensure that we're bringing more people in as we have availability and increased supply.
All right. And our final reporter in the queue did receive an email from Christine from King 5.
Hi, thank you so much for taking the call. I'll just make it quick while I have an opportunity to ask, because a lot of the questions I had were already addressed earlier. Could you talk about, we've talked about the rollout of the vaccine being opened up to everybody eventually by May 1st. We're comparing other states and why Washington has not been able to meet, a quicker timeline. But could you also speak about how surprisingly impressive it has been in order to roll out as quickly as we have? Because, a month or so ago, we thought that we wouldn't be able to be fully vaccinated until summer or possibly even fall. And now here we are in April. Are you surprised by the the speed in which this is being rolled out?
Christine, thanks for that question. You know, I think you first of all, congratulations. You're the last. You got the last question, so we were able to get to you. So it's great to be able to hear that you have this question, because it is really an important one. We have to recognize that when we work together, and that means federal partners, that means state partners, that means local partners, that means community partners. When we work together, that's exactly what we can do, is we can accomplish so much. And when we are not working together, which unfortunately at the beginning of this pandemic was the real challenge, and we continue to have those challenges from the standpoint of it's not perfect and not everyone has agreed on everything even now. But when we work together, we can accomplish so much. It's really up to all of us to be thinking about what is our part in togetherness and working across aisles and across systems and across communities and across just people, you know, just families and neighbors, right? To talk to your neighbor. I got vaccinated, and your neighbor is saying, I'm not sure I want to get vaccinated, just to go across, you know, and have a conversation to say, you know, here's why it's important to get vaccinated. I mean, there are some things that we really can do together. And, you know, this, the fact that we are where we are is incredibly important for all of us. We know that vaccines are the pathway to the future to get us out of this pandemic. We are so grateful to the administration for continuing to push on the pharmaceutical companies, the vaccine manufacturers, and the entire process to be able to get more vaccine supply into states. We do want to see more of that. We want to see more coordination. We want to see better use of states as partners, and we want that to continue to improve over time. But we are very pleased with the progress that we have made. Is it perfect? Have we gotten out of every issue? Have we tackled every issue? Absolutely not. And this is going to continue to be like this. And here's the breaking news. It's going to be like this for the next several months. So if any Washingtonian thinks that we're going to have everything smooth until we get everyone vaccinated, the answer is we're not. It's not going to be smooth. There are going to be challenges, and there are going to be real concerns and impediments all the way throughout this process. But when we work together, absolutely, this is what we can achieve. So we're really pleased by that. We do believe that we can continue to move forward. I have to, you know, give so much credit to Governor Inslee and his team that have worked hand in hand with us daily basis. We're communicating, we're having conversations, we're working with our partners at other state agencies across the system as well. And then certainly our local partners on the ground that are just doing so much every single day and night and weekends and holidays. And I just can't say enough about that. So yeah, we are very pleased. And I hope our community members really look at this, and Washingtonians are not thinking about this as, oh no, this is not going well. This is going to be expected of where we are, but this is also our path forward. So again, don't hesitate, vaccinate. And we are pleased with where we are, but we also recognize that there's a lot more work that we need to do in order to achieve our ultimate goal, which is to get out of this pandemic safely and as quickly as possible. Corey, I don't have to actually give a closing. I think that pretty much was it. So I want to thank her for that last question.
All right, and thanks for carrying us out. This concludes today's media availability. I'd like to thank our panelists for their time today and for going long to accommodate our media queue. And I'd also like to send a hearty thank you to TVW for hosting today's live stream and archives of past briefings, which you can check out at tvw.org